My name is Mona Nasser. I'm the Associate Professor in Evidence-Based Dentistry in the Dental School. So I'm very much interested about how we can design research systems that can be responsive to the needs of stakeholders. When I started my career as a dentist years ago, I realized that there's a mismatch between a lot of the research that's happening and the needs that I have as a dentist. I later joined a policymaking institute in Germany, and I realized that even for important policy questions, we have the same problem. There is a mismatch there. So I was quite interested to see, so how do we make decisions? What research is more important and why we are not addressing those gaps, even in applied research. So a lot of my research is trying to identify the issues that they are and tries to come up with methodological solutions and suggestions for it. I started studying first Cochrane and looking at how they do prioritized research, and also encouraging the Cochrane groups around the world to change how they approach it. And we integrated a lot of those methodologies into the guidance of Cochrane. But a lot of research groups who were associated started picking up those methodologies and requesting us to help them with how to inform their priority setting approach. And we are currently working with the European Office of the WHO about another project about providing further priority setting guidance across Europe and other countries. So I started working with national research funders. The work that I did with them, it was broader. The priority setting was one of them, but we also looked at other areas of research. What we did was we worked with a group that is called the Reward Group. The Reward Group focuses on what practices we have to change to reduce research base. And some of these national research funders after that came together to build a funders forum to address them. So, and I'm observant on that forum. And what we are doing in that forum is that it started with those evaluation, identifying the gaps and some of the solution that has been suggested. And those solutions became some of the guideline principles and consensus statement. And now each group is working specifically how to address it. There is another collaboration we built up that is collaborating with this a forum to address some of those issues identified in that paper, which is the Evidence-Based Research Network. It's useful to have systematic evidence that what research has been done before you start new research. It sounds obvious, but it doesn't happen. And now we are kind of working more about understanding what are the implementation issues that they have, how we can improve it, and that's the future research we want to address. And also to identify areas and point out to them to some national funders or other organizations that they could improve the funding practices to ensure that they have more value for research.